Good morning, ma'am.
Yeah, good morning.
Morning.
Sir, good morning, sir. So I spoke to Sarin, sir. Sir will be joining in just 2 minutes.
Yeah. इसमें से मेरा दूसरा चश्मा निकालो चश्मा. That specs. This one is not working. That side. Hello.
Yes, sir.
Yeah, good morning, sir.
Morning, sir.
Hello. Good morning. Good morning, madam.
Morning,
Good
Sarin.
morning. Sorry for the delay.
Okay, sir. Okay, sir.
Ma'am, we'll start the session.
Yes.
Distinguished professors and learned participants, a very good morning to all of you. I extend a warm welcome to the 6th day of 1-week online faculty development program on emerging trends in pharmaceutical sciences, challenges from academic research to commercialization. Let us proceed with the session 7 of faculty development program. Now I request our young and dynamic beloved principal madam to speak a few words.
Distinguished luminaries, faculty delegates, my dear fellow faculty members, a warm welcome to one and all. It gives me immense pleasure in inviting today's speaker, Dr. R.K. Sarin Garu, National Forensic Science University, Goa. Thank you, sir, for accepting our invitation. We all know that you are so busy with your hectic schedule. In spite of that, accepted our invitation to address today's gathering. Coming to today's topic, to understand the drugs and substances under Narcotic and Psychotropic Act 1985 is very essential for the participants because according to the government of India has prohibited a person to produce or cultivate or sell or any narcotic drugs or psychotropic substances comes under offenses and penalties. So this session will be helpful to all the delegates. We must know what are the do's and don'ts and the objective of the today's session. It will be quite useful for the students for their future career. I appreciate the Department of Pharmaceutics for arranging such a wonderful lecture by inviting Dr. R.K. Sarin Garu from National Forensic Science University. And I hope Sir will cover about the funding agencies also for focusing on the research in this Narcotic and Psychotropic Act area. Thank you for giving me this opportunity.
I'm honored to introduce the eminent speaker of today's session, Dr. Rajendra Kumar Sarin, sir. I heartily welcome the dynamic, highly knowledgeable, focused, determined, proactive, and august speaker of today's session, Dr. Rajendra Kumar Sarin, sir, Professor, National Forensic Science University, Goa, to deliver a scientific talk on the topic entitled Narcotic Drugs and Psychotropic Substances, an Overview. Now let us listen to the brief profile of Dr. R.K. Sarin, sir. I request Dr. N. Kankadurga Devi, Madam, Associate Professor, Department of Pharmaceutics and Biotechnology, to present the brief profile of Dr. R.K. Sarin, sir. Over to Dr. N. Kankadurga Devi, Madam.
Good morning, all the delegates. Welcome to today's session 7 on narcotic drugs and psychotropic substances, an overview by Dr. R.K. Sarin, sir, Professor, National Forensic Science University, Goa. It's my privilege to introduce today's speaker, Dr. Rajendra Kumar Sarin, sir, completed graduation from Birendra Narayana Chakravarti University, Kurukshetra in 1976. Post-graduation on doctorate from Meerut University. Dr. Rajendra Kumar Sarin, sir, successfully completed as a scientific assistant, senior scientist assistant in Forensic Science Laboratory, Haryana. Next, chemical assistant in Central Revenue Control Laboratory, Central Board of Excise and Customs Department, Revenue, New Delhi. Sir has completed SSA Junior Enlist in Food Research and Standardization Laboratory. As Assistant Director in Central Forensic Science Laboratory, Chandigarh. Next, as Deputy Director in Central Forensic Science Laboratory, Hyderabad. Next, as a Deputy Director cum Coordinator in Central Forensic Institute, that is Government of India, Bhopal. As a Director in Forensic Science Laboratory, Government of NCT of Delhi. Next, as a Director, Central Forensic Science Laboratory, Government of India, and as a Director, Forensic Science Laboratory, Andhra Pradesh. Next, as a Professor, currently working as a Professor in National Forensic Science University, Goa. Sir has completed successfully such projects as a project leader, that is feasibility project under non-plan entertaining development of analytical methods for the detection and estimation of diazepam in non-alcoholic beverages and fruit drinks of various makes. Next, as creation of centralized data bank for source identification of opium. SAR has several research publications and presentations in reputed journals and as well as conferences. SAR has awarded, appreciated honorarium, has received appreciation letter and honorarium regulatory from Director CFSLS and Chief Forensic Scientist DFSS MHA Government of India, New Delhi for outstanding and extraordinary works as mentioned above, whatever the different in R&D and as well as the academic. Next, a special recognition and appreciation was received in person for providing the technical inputs to the team of judges from Honorable High Courts of Delhi, Punjab and Haryana for making the draft rules under IT Act 2001. Next, special recognition and appreciation was received in person from the members of Guwahati High Court Appeal Committee for providing suggestions towards the improvement in functioning of state regional FSL Assam Johat. Next, received recipient of prestigious Union Home Ministers Award in the year 2007 for recognition of outstanding contribution in the field of forensic chemistry. SAR has honored as chief guest of honor in the seminars in various topics of forensic sciences conducted by Maharashtra Jananand University, Rohat, New Delhi University, Punjab University, Patiala, then Noida, Kurukshetra University. Then Lifetime Achievements Awards 2018 by Association of Forensic Science Society in International Conference on Advances in Forensic DNA Technology organized by APJ Abdul Kalam Institute of Forensic Science, Jhansi. Next, awarded Best Forensic Expert Award in Toxicology and Chemistry Division in the National Forensic Science and Criminal Investigation Summit Awards 2020. Now, I welcome today's speaker to deliver his valuable talk. Dr. Rajendra Kumar Serin, sir, please.
Thank you, madam, for giving a elaborated and a nice introduction of mine. First of all, I will like to thank the organizer of this conference, Faculty Development Program of Department of Pharmaceutics and Biotechnology in association with Siddhartha Pharma Innovation Incubation and KVSR Siddhartha College of Pharmaceutical Science, Vijayawada, giving me this opportunity to interact with the pharmacy people, and normally I am interacting with the forensic people or analytical like food laboratories, and but this is my first opportunity to meet all the pharmaceutical scientists and academicians. So let me start my lecture on narcotic drugs and psychotropic substances. I will share my slide.
Yeah.
Now, is it visible to you?
Yes.
Yeah, visible, sir.
So I will start with my.
Sir, maximize the screen.
Yeah. Maximum.
No slideshow. Not there. No.
You can click on from current slides.
Oh,
The top slideshow is available.
I can click off the slide.
Hmm.
Camera and voice. This one.
Down side, down is also there. Corner, extreme. Right, down
Right.
corner, slideshow.
Camera.
Sir, see at the top, it is showing slideshow.
Camera.
Click on slideshow. Click.
Transitions, animation, slideshow.
Sharan.
F. F5 also, sir. You can click on F5 also.
Sir, on the top home, insert design, transition, animation, and
Slideshow.
slideshow.
Yes. Click on it, sir. Slideshow. Karin, sir.
Camera. Camera.
Karin, sir, can you hear me?
Yeah, I can hear you.
Yeah, see the screen top upper part, there is a displaying animation, slideshow, review.
Yeah.
There click on slideshow, sir.
Slideshow.
Slide.
It's displaying insert design. Beside animation,
Sir, super.
yeah.
Yeah, yes, sir. Yes, sir. Yeah.
So now it is visible, huh?
Yes,
Yeah,
Yes, sir. Yes, sir. It's clear.
So let me start my presentation. This one is not right. This one. Yes. So now my topic of today's discussion is for me is narcotic drugs and psychotropic substances, an overview. Why I am propose this topic in your this faculty development, because this is also a part of the pharmaceuticals and many of the drugs which are of the pharmaceutical purpose. They are covered under the narcotic drugs and psychotropic substances also. And a lot of under the counter drugs are being used for intoxication purpose. And in forensic science lab, we are receiving mainly the narcotic drugs only in the chemistry section, and sometime in we are receiving pharmaceutical drugs also for the purpose of somebody done suicide or toxicological section. While in chemistry section, we are receiving only narcotic drugs for identification purpose, because you know that Narcotics, Drugs and Psychotropic Substances Act has a very provisions for the very severe punishments, and so many people are not even aware of that what is permitted, what is not permitted. So let me start with the introduction. A drug is a chemical which is given to the people in order to treat or prevent illness or disease. So drugs, it's a general definition. In modern concept, the drug today means chemicals consumed to cure ailments, and consumed for euphoria and hallucination also. So there is both the things. There is a drug use and drug abuse both. So drug use is already discussed, cure illness, prevent diseases, and improve the health conditions. This is for the use of the drugs, and the abuse is to elude oneself from pressure of life to end one's life. Like in toxicology section, we are receiving cases where the drug poisoning is there, overdosing is there. Then to get pleasure also, this is the some of these are the some of the and these are some of the abuses of the drugs. So narcotic drugs and psychotropic substances means narcotics means it is from Greek word narkotokos, means state of lethargy. And originally it was referred medically to any psychoactive, means altered state of consciousness compound, means which alters the state of consciousness, and with have a sleep inducing properties also. Then pharmacologists define it as a narcotic substance are those which bring relief from the pain and produce sleep. So narcotics are especially useful in practice of the medicine for the relief of intense pain. They are the most effective analgesic also. So many of you might have heard the name that so many analgesics are coming, like morphine, morphine preparations, and like tramadol, and so many are there for analgesic purpose. They are the most effective analgesics known, the narcotics. Others are not that much of, some are not included, like now from 2018 onwards, this tramadol also been included. So they are also being used for cough suppressants also, like codeine phosphate is one of the cough suppressants. And there is a remedy for diarrhea in the old time also, in the ancient time also, people use this opium and others for using as a medicine for the children pain and others. So they have a for physical and psychic suffering also. They are being give relief, and this they are being used in various manners, like by orally taking or sniffing or smoking also. So the actually the legal definition of narcotics that is national and international legislation. They have listed substances under specific categories, like schedules. There are schedules. There is a schedule for the NDPS Act. There are schedule for the NDPS rules also. There are 3 schedules for the NDPS rules, and there is 1 schedule for the NDPS Act. So in India, this NDPS Act, Section 2, Class 10, means how these narcotics are defined. They are in the Class 2nd, Class 10 of the Section 2, coca leaves, cannabis, opium, poppy, straw, and include all manufactured drugs. So this is the legal definition of the narcotics, drugs, and psychotropic substances. However, there is a lot of drugs, and they are classified, and their classification is based on the basis of physical and psychic effects, and some other way of classification is also there, like in physical and psychic effects. Analgesics, they are pain relief without rendering the users unconscious. These are all narcotics and non-narcotic drugs. And then depressants, like they lessen the activity of central nervous system and diminishes vital functions, including relaxation, used as a sedatives to induce sleep. Examples are minor tranquilizers, barbiturates, and opiates. Then there are hypnotic drugs that also depresses the central nervous system activity, and they produce sleep. The example of hypnotics are also barbiturates, which is there in the list of depressants also, and hypnotics also. Then methaqualone and chloral hydrates. These are some of the hypnotics. And then the next category for classification is stimulants. Stimulants, they stimulate in place of depressing. They stimulate the central nervous system activity, and they are illicit therapeutic use are like appetite. They to reduce the weight. They are being used for this. They are given this for the weight reduction also by their in the medical prescription. But they are also used in dope also, like in sports also, amphetamines and cocaine. They are stimulants. And then there are hallucinogens. They act on central nervous system, and they are they change the mood and perceptual changes, and they are the very dangerous type of narcotics drugs, and they form a sensory illusion to the sensory hallucinogens, and they are like LSD, phencyclidine, and psilocybin, and cannabis products. They comes under the category of hallucinogens. Then there is another way of classification that is based on the following, that is the material from which they originate, whether they are natural or synthetic, and their general chemical makeup, and abuse potential and addiction liability. So on these four bases, there is an international classification of the narcotic drugs and psychotropic substances. So first category is natural and synthetic narcotics. Natural narcotics are opium, morphine, codeine, and amphetamine and codeine. Like this, thebane, these are all opium alkaloids and natural. Then there comes the semi-synthetic narcotic, that is Distal Morphine, DAM, which is also a very popular narcotic, that is heroin. And there are various names for the heroin, like brown sugar, there is smack, and these are all the names of the heroin. Then some name like God also is there. Then there is a hydromorphine. This is also this in the trade name of morphine, morphone, and dihydromorphine, and diludid, and oxycodone. These are some of the trade names, and they comes under the category of synthetic narcotics. Then synthetic narcotics with high potency opiates, means synthetic narcotics which they have a very high potency. They are synthesized, and they are some of the are methadone, and their trade name is maybe more popular to the pharmacy people, like amidone, phenadone, and dolophone, eptadone, methronone. These are some of the trade names. And then after this, the category comes synthetic drugs with low potency. These are the synthetic drugs with high potency. With low potency, dextropropoxifen, that is trade name is propoxifen, and dapronal, like this, and some of the other like SK65, Pro 65, Dolin, Dolocap, etc. So these are the low potency narcotics. And second category comes, these are the natural and synthetic narcotics. And then comes another category that is called cannabis product. This is a separate category. And this cannabis resin, hashish oil, ganja, bhang, charas. All these are the product of the same plant, Cannabis sativus, and they are being very much in the market for the intoxication purpose, and these are very popular narcotics substances. And then the third category is the cocaine and other coca product. This is also a separate category. This name are tropococaine, cocamine, and cocaine. So these cocaine and other, this is a separate category for cocaine and other coca products. These are also used in the dope in the dope testing. They are for the sportsmen. They use it for their increasing the strength and muscle strength. Then next comes the barbiturates and other sedative hypnotics. These are like methaqualone and barbiturates. This category, these barbiturates are depressants, but they are used. They have a medical use also, and a lot of medicines are coming in psychiatric treatment also. And then there are minor tranquilizers. Another categories, that is, these are the benzodiazepines, which are diazepam, nitrozepam, lorazepam, oxazepam. These are pain relievers and also used in the treatment of psychiatric treatments. So these are also comes under the narcotic and psychotropic substances. And another category is amphetamines and related stimulants like methamphetamines and amphetamines. These are actually stimulants, and they are used in the sports persons also use this one, and the doctors also prescribe for weight reductions and others. So these are also narcotic substances, and they are also coming in one of the schedules of the narcotics rules, NDPS rules. And then there are another category, which is a different category, separate category, like LSD and other hallucinogens, like lysergic acid, diethylamide, and LSD and psilocybin. These are some of the psilocybin, and these are some of the plant and mushrooms which contain this, like phenylcyclosidine and psilocybin. And then dimethyltryptamine. These are all LSD, and these are all hallucinogens. Then controlled drugs and analog designer drugs. These are another category which they are coming under control, and so many other derivatives are formed because to escape from the law and to make something which is not covered under NDPS. These drug addicts and some clandestines laboratories, they prepare some designer drugs. So these type of things are very much used in the designer drugs. Even the cannabis derivatives are being prepared so that they are not included in the NDPS schedule. Later on, when they are misused, then they are also by way of notification, they are also included. But by that time, this can be used, and even they are not caught under the NDPS Act. So these are the controlled drugs and analogs, designer drugs. Then there are misuse of the organic solvents and inhalants also, like paint thinner, color removers, even ghee, gasoline, means petrol, and other petroleum products and cleaning fluids. They are being used for the purpose of intoxication. And this is another international category, but these are all not directly coming under the NDPS Act, but they are being used for the abuse purpose, misuse for the purpose of intoxication. Then we will go one by one and we'll study each category, like some of the popular popular narcotic substance which are covered under the natural and synthetic narcotics. So first of all, natural means opium. Opium is very popular, and it is having a very much used for the medical purpose also. In fact, this opium is from it the 5 major alkaloids are there, like morphine, codeine, theanine, papaverine, and narcotine. So out of these, 3 are covered under the NDPS, 2 are not covered. So these NDPS, opium is this is actually, if you go by legal definition, they are covered under the section 2 of the and class 15 of the NDPS Act. So defined, opium has been defined as a coagulated juice of opium poppy and any mixture which or without any neutral material, but does not include any preparation containing not more than 0.2% morphine. Means below 0.2% is not covered under the opium, because punishment will be not as per the opium that it is an opium, but it may be covered in some other class. But if it is used less than 0.2%, it will not be covered under the opium definition. So this is a coagulated latex of Papaver somniferum. Actually, this is a plant, and it is grown legally also in our country under the control of Narcotics Commissioner, Narcotics Department, and their lands are given on lease, and there are there are some states where only it is legally grown, like Madhya Pradesh, Rajasthan, Uttar Pradesh. There is they are cultivated under the control of Narcotics Department, and this is collected, and after collection it is sent to the factory, and there are 2 government factories. They can only process and further make further isolate the alkaloids, and they are also being exported, and a lot of revenue is being collected. That's why it is coming ultimately under the revenue department and narcotics control. Narcotics commissioner only have a control over it. So medicinal use, everybody knows, and it's alkaloid, morphine, codeine. They are very commonly used in the for the medicinal purpose. So some preparations are being made. So there are about 25 organic substances that can be extracted from opium, because it is also being seized, and the police is sending to the forensic science lab, and we have to identify and declare it whether it is a narcotics. This is a opium or not as per the definition. So we have to do some tests. First of all, we will see that what is the composition of this opium. It is actually there are about 22% of alkaloids contents are there. Major which are the most means active principle of the opium, and there is a meconic acid, lactic acid, sulfuric acids also is there, 19%. Then there are sugars, proteins, peptides, and ammonia. That is also 15%, and wax and fats, and unknowns, and moisture. This is the general composition of the opium. Why I am telling this? This has some relevance in forensics. That's why I am discussing all this composition. Major opium alkaloids are these 5 alkaloids, out of which papaverine and papaverine and nascopines are not covered under the NDPS, and they are all the 5 major. There are about 40 alkaloids, but the presence of these, when we test for it, we go for a test where we have to prove it. Some of the specific, then porphyroxine test. This porphyroxine is especially mostly present in the Indian opium, and there are certain other tests like color tests, like Marcus test. Marcus test is common for so many alkaloids and so many drugs. And after these chemical tests, we have to do thin layer chromatography. Actually, in fact, this papaver somniferum is as per the act. We have to prove it that it is a latex of the papaver somniferum. So we have to identify these 5 major alkaloids, which is only and only present in papaver somniferum. Not in there are papaver other varieties of the papaver, like papaver oriental and papaver roins. These are all other varieties, but our concern is opium is the latex from that is called opium papaver somniferum. So these 5 alkaloids are the only present in a papaver somniferum. In some there are 3 alkaloids, in some there are 4 alkaloids, but maybe 2 alkaloids. But all the 5 in this variety only, Papaver somniferum. So that's why we do thin layer chromatography and identify. And this is the how we do the TLC. And then we do the actually qualitative by ultraviolet spectrum photometry also. And color by colorimetry also, the quantity of the morphine is also calculated, because any material which is to be declared as opium, it should contain at least 0.2% of morphine. So we have to, in quantity only, we have to do for morphine only, and there are HPLC methods are available, and infrared spectroscopy for qualitative confirmation, and GCMS is also for the gas chromatography with mass spectrometry is also for the qualitative confirmation. So these are the commonly performed tests, but we found a lot of difficulty in opium for even in HPLC also to separate the 5 alkaloids, and for quantitation purpose or to identify 5 alkaloids. If quantity is less, TLC alone will not work. So we have worked on it, and GC, this is GCMS. GC is good technique for the separation because it is having more theoretical plates for the, it's a high separation power, but problem is the thermal instability of all these, and there is exact concentration we cannot get. So we have done some work on it, and we have developed a method which is capillary electrophoresis. Capillary electrophoresis has not been so far explored for organic matter for estimation or identification, but we have used this technique. There are many modes in capillary electrophoresis. We have utilized the capillary zone electrophoresis mode, and you know this is a very powerful separation of the organic compounds. It can, because of the, you know, it uses the millivolts or the potential for the separation. At the same time, gel electrophoresis has been replaced by capillary electrophoresis, where a lot of problem due to heat dissipation problem, and there is a lot of diffusion and separation is not good. So this capillary increased the efficiency also by way of because narrow bore capillary, and it's not having any supporting material, or so this is no problem of the heat dissipation is easy here, and the separation is very good. You see here, because we have HPLC method, we have a GC method. HPLC has its own disadvantage of that it is not able to separate the peaks properly, and because it is having very less efficiency because the size of the column is less, and this is liquid chromatography, and that's why pump is used for passing the liquid. And so that is, separation is not good in HPLC, but because of the thermal instability, recommend the HPLC method for estimation of these opium alkaloids and others natural product also. This is the problem. So this capillary electrophoresis is having combined advantage of gas chromatography and high performance chromatography, because it is also, it can be performed in the liquid state in the solution form. Buffers are used as a solvent. Running buffers are used, and so there is a problem of thermal instability doesn't come there. Those compounds, even thermally unstable, can be done here, and at the same time very sharp separation and accuracy. So online detection with the help of UV detector or fluorescence detector in capillary, there are even mass detectors are coming in the capillary electrophoresis. So we done, and we published a paper in 2000, in the year of 2000 in a very reputed journal. And we developed this method for the simultaneous determination of all the 5 alkaloids, which is an achievement in an hour's time. even suppression time is only half an hour, and we done with the help of reference standard quantitative as well as qualitative analysis. So this is one of the method which can be used for other organic compounds also because of its advantages. And we actually done a project on it also because for our problem was that though no doubt these agencies, law enforcement agencies are sending these to us for the purpose of identification that whether it is a proper somniferum or not. But the actually to block the actual source of smuggling, actual source of this opium from where it is being, because it is also being manufactured, it is also being processed in some of the government opium factory. From there it might have come, or some illegal cultivation may be there. So to find out from where to help the investigation, or to help the police in finding out the actual source of these narcotics, because this is opium is a source for even heroin also. Heroin is prepared from the opium only, because from morphine to distyl morphine is prepared. So that's why we done this project in the year 97 to 2022, wherein we done these all parameters to find out the source identification by profiling various various constituents of the opium, major and minor both. Like we done fatty acid, also we done amino acids also by liquid chromatography, amino acid analyzer, and we done with the trace elements also, and then crystal examination and principal electrolytes, where we use the capillary zone electrophoresis first time, and it was very successfully. We collected 124 samples of the of our country, because out of the country it was difficult for us to go to get the samples from across the country. A lot of procedures are there. So we developed this methodology, and then we wanted actually to create a national database for the future also. But unfortunately, that project was closed, and it was not again extended. So that's why we done a preliminary study, and we found some of the marker things where we can distinguish on the basis of the profile of the that particular constituent, that this belongs to this place. We used discriminants analysis using statics, and we found 3 groups and in the country, that some of the samples are falling in one group, some are falling in second, and some are in third. Actually, the outcome was that the group first is from Bareilly site samples we have taken from the opium factory, but they told us from where the cultivation from the, because they are the legal source factory, so they are collecting. This is government factory, and the revenue department, the cultivation is under the control of narcotics department. So they were able to tell us from which container we have taken belongs to which area. So we just divided these three groups, and we found one of the very marker things. We found that some of the alkaloids were missing because all the 5 in alkaloid analysis, we done the simultaneous analysis of all the 124 sample and their quantitative also. So we found that a lot of changes. Earlier, the morphine was being told that it is not more than 12% or 15%, but we found 23% morphine is there. A lot of changes with the time, with the soil, with the environment, lot of fertilizer use. So this is one thing, but another thing from the investigation point of view, we found that there is a papaverine alkaloid in these 3 areas we found. So this is a very marker thing, because we say that all the 5 alkaloids should be present to declare it is a opium. But this is a research finding, and it cannot be implemented unless and until in the act, unless and until a continuous study is done. So this was the marker to find out that this opium belongs to this particular area. So This was the finding of our research, and now this after the natural we will go for a after natural narcotics we'll go for a semi-synthetics. What are the semi-synthetics? Their semi-synthetics are partially chemical. Synthetics are type of chemical that uses chemical compound isolated from natural sources as starting material to produce other novel compounds which have distinct chemical and medicinal properties. The very popular and important example is the distal morphine, which is heroin, smack, or acetomorphine or brown sugar. This is narcotic analgesics, and its potency is 2 to 3 times than morphine. And these have very high addiction liability, and it's actually this drug. 2 or 3 drugs are not allowed for any manufacture anywhere in our country or anywhere in the world also. Synthesis of this is not allowed. So this is only no medical use for this, and its lethal dose is 0.05 gram for a 70 kg normal man, and this very potent one. So under the act, it is defined separately as it's in the opium derivative, which is subclass D of the class 16. So distal morphine is the alkaloid, also known as the dimorphine or heroin, and its salts. It is mentioned in the NDPS Act. So this should be, if you identify that this is a distal morphine, then we can say that the seized material is having heroin or not. So this is one of the important semi-synthetic. Other this is testing is done for heroin by chemical tests, color tests like Marcus test and Frode test, and then there is HPLC PDA detector. Using this, we can detect it, or thin layer chromatography and GCMS or IR. But we have not included heroin because nobody has done. We have not extended our work. Otherwise, because heroin is also thermally stable, not stable, unstable on the temperature of the GC detector. So sometimes we are not getting peaks in GC also. And if you go for an HPLC, separation is very poor because of the low efficiency. Number of theoretical plates are less in HPLC. So this Marcus test is common for many of the narcotic substance. These different colors are given for the response of the morphine. Even sugar has some color with the morphine, but this heroin is having like this slightly of purple to reddish color. This heroin gives this color, and these are some of the instrumental method for quantification and qualitative analysis. So we have to report in our reports. We have to give a full proof analysis of the heroin, because someone is caught, and if it is something else, and we give it a heroin, then the punishment is very, very stringent in all the narcotic substance. It is 10 to 20 years. Earlier, it was even second time person caught, it is death penalty was also there before, I think 2014 or something. But still, it is very, very stringent punishment. So the analytical technique should be very, very conforming, and we use all these techniques. This is the mass spectrum of distal morphine. Some of the mass fragments are given. So one more thing is there. So now the law has been amended, and this bulk material, some of the impurities are added in the heroin, like starch, sugar, powder milk, quinine, caffeine, paracetamol, and phenobarbital, and benzodiazepines. So sometimes the court of law, it is asked that if it is not heroin, what it is and how much percentage is there. But nowadays, after the amendment in 2008, the quantity has been now will be the bulk quantity, not the pure heroin, for deciding that whether it is punishment is less, because for self-consumption there are small and commercial quantities, punishment is based upon that. Small quantities, very less punishment for self-use. And for commercial quantities, 20 years, 10 to 20 years, rigorous imprisonment. So that is why this all other diluents are used, which may also interfere in testing. So we have to separate from these impurities. Then presence of impurities can cause hydrolysis of heroin also. This also sometime problem when we are handling the samples of heroin. So distal morphine converts into the monostal morphine, and then finally to the morphine. If in the police or in any law enforcement agency sent us the heroin and we are not able to report heroin, then a question comes. Then we can justify that if it is time is more, then it might have gone to monoacetyl morphine or morphine also. So it was originally heroin. So then about the synthetic narcotics, some of the legal definitions and some of the things are written in the NDPS Act, that synthetic opiates are a class of drugs that are manufactured in laboratories and designed to have a chemical structure which is similar to opioids, naturally derived from the opium poppy. The chemical makeup is similar between synthetic opiates and natural varieties, like many prescriptions of opiates. The specific compound that make up synthetic opiates are entirely man-made and typically in a pharmaceutical laboratory. So this is about synthetic narcotic, and legal definition says that class 11 subclass that manufacture drugs. Synthetic narcotic means coca derivatives, medicinal cannabis, opium derivatives, and poppy straw concentrate. Any other narcotic substance or preparation which the central government may having regard to the available information as to its nature and decision, if any, under any international convention in the official gazette, declare whatever government declares under this treaty or under NDPS Act, that will be defined as a in section 2 class 11 subclass B as a synthetic narcotics or manufactured drug. Actually, in the act it is written manufactured drug. If any under the any international, but not the manufactured drugs. It is the comes under the these are all comes under the synthetic narcotics. So next is the methadone, which is coming under this, then there is a meperidine, and then dextromorphine. These are all synthetic drugs, and then pentazocine. These are mostly in pharmaceutical purpose only. In laboratory, we analyze using chemical color test, thin layer chromatography, UV, IR, GCMS. Generally, we follow the UNDCP manuals, United Nations Drug Control Program manuals, and in that methodology is also given, and the techniques are also given. Which technique is the confirmatory techniques, which are the not the confirmative but the presumptive techniques. These are all presumptive TLC and chemical tests. But even some of the laboratories, forensic labs are not having facilities for the sophisticated instrument like IRGC, HPLC. So we even in the act it was written earlier that even the 2 TLC, thin layer chromatography with 2 solvent system will suffice for confirmation. So some of our FSLs which are not having all the facilities, even they confirm with TLC also, but provided they use 2 solvent system and RF values are matched with the standards. So next is the cannabis products. This is another category after natural and synthetic and semi-synthetic category. So these cannabis products, cannabis means cannabis is a cannabis sativus, and these are the major 3: charas, ganja, and bhang. Bhang is not covered under the this act, and charas, and these are the separated resins from whether crude or purified. The definition is very broad and obtained from the cannabis plant, and also includes concentrated preparation and resin known as hashish oil or liquid hashish oil. This is written in the legal definition, and this is in whatever form. Whatever form means if something is herbal material is added also in the resin, and resin quantity may be less, quantity is not written. So this is comes under the charas. And another one is the ganja, which is also very popular. And this is also flowering and fruiting tops of the cannabis plant, excluding the seeds and leaves when not accompanied by the tops. Whatever name they may be known or designated. Means ganja may be some other names and the common names are there, but if the preparation is like this, which is having flowering and fruiting tops of cannabis plant, then with this, which is covered under this definition, it can be declared as ganja. And any mixture with or without any neutral or any of the above form of cannabis or any drink prepared therefrom is also covered under the legal definition of cannabis or hemp in that section 2, class 3rd of the Narcotic and Psychotropic Substances Act 1985. So next is the cannabis plant, and this also covered any plant of genes of cannabis, and leaves and seeds separated as such from the plant are not covered under NDPS Act. Means plant is covered, but leaves and seeds, then it will not cover under the NDPS Act. So bhang is not actually the active principle in all these three are tetrahydrocannabis, and these are all to distinguish as per the definition, because definition is broad, and sometimes we are getting difficulty in identifying whether it is a ganja, charas or bhang, because the definition is very broad for charas also, and there is quantity is not possible because only they vary, because only this bhang contains very less quantity of the THC, that is maybe below 0.5%, and while these other material like charas and ganja, charas is having highest quantity because it contains resin, and resin hashish oil is a pure oil also, scent which is having highest quantity of THC, maybe up to 9 to 10% also, and this is identified by testing whether it contains tetrahydrocannabinol or not. These are the structure of some of the cannabins or cannabinoids of the tetrahydrocannabinol. So this in the laboratory we are doing physical examination, microscopic examination, botanical examinations. All these are done to identify the plant, the cannabis sativus plant, and chemical tests are also done in the laboratory. And the cystolith hair is the peculiar feature of the cannabis plant, and these trichomes having cystolith hairs. So this is one of the tests, and other chemical tests are there, like fast blue B test. This is a color test also can identify, because Deaconess Levine test, and these two tests are easily done in the laboratory. And after color test, we do the thin layer chromatography also for with the help of because ultimately if THC is there, it will give fast blue B test, and TLC color visualization done with the help of fast blue B by spraying. So thin layer chromatography, then gas liquid chromatography. This is also done for THC detection, but THC is a very unstable compound, and getting a reference standard is very, very difficult in for us. And that's why this GC is performed. But if a GC is MS, if it is having library, then it can be compared with the GC peaks, GC mass fragments, and mass spectrum. Otherwise, difficult to identify unless we are not having a standard. In GC, we cannot compare the peak. And even doing the quantitative also very difficult, because giving quantity is okay, but it is an unstable compound, and the quantity may not be that much of level that we can distinguish it is a ganja, charas, or something else like hashish oil. So this is a difficulty in this identifying this type of cannabis products. So these are some of the laboratory tests. And then there are cocaine and other compounds, stimulants. So cocaine is also very potent narcotic substance, and it is also banned for synthesis also, but illegal preparations are being done with the help of lime, kerosene, or gasoline is used. So now, if cocaine is there, we may by smell also we can guess something that it might be cocaine because it is used in a illicit preparation. Kerosene, use of kerosene is there. So it is from the Coca plant, and some of the other Coca products are these are the some of the other Coca products like cinnamol, cocaine, or cinnamol methyl icocaine, or some benzoyl choline and icocaine. These are all some of the other Coca products. All are banned under NDPS Act. So these are the some of the ways of using it. Cocaine, this can be used as a cocaine by sniffing through nostril or dilution and injected intravenously. Also, it is white crystalline powder. Its effects last from 1 to 2 hours. Then legal definition of coca and coca derivatives are this is given under section 2, class 5th. You can read the act, and if it is under this definition only, we have to identify the substance. Otherwise, if it is not matching with the definition, it will not be covered under the NDPS Act. So it will not be liable for the punishment. So under section 2, class this 6 coca leaves also their definition is given. Then these are some of the tests of the cocaine which we perform in the laboratory. There is a physical examination and chemical examination. Scott test is very famous test, and with this test we do the color test for the cocaine. TLC is also done. Then we do UV visible use of UV visible for lambda maximum absorption also is checked. And then quantitative can be done with the help of GLC or HPLC or LCMS, liquid chromatography with the mass. These are some of the peaks. These are mass spectrum of the cocaine. Then the fourth category comes the barbiturated and other sedative hypnotics. These are depressants. These are depressant and operate by inhibiting the transmission of neurological signals. And barbiturates, they are anesthetics and anticonvulsant in the for the medicinal uses. Anti-anesthetics and anticonvulsant and sedative hypnotic, and they are used in the veterinary also as a anesthetic, and they are there are a lot of varieties of the barbiturates, and they are being synthesized. 12 are subject to the international control only. That it affects lasts from 1 to 16 hours. They are having long effects. And they are also used some of the psychiatric medicines also. I don't have much idea about the medical use, but whatever I know, I can tell that much only. Then legal definition of this is also covered under section 2, class 23rd of psychotropic substances. They are covered, and this is according to this means any substance, natural or synthetic, or any natural material, or any salt or preparations of such substances or material included in the list of psychotropic substances is specified in the schedule. And also these are covered under schedule of the NDPS rule 53 and 64. They are coming under the schedules of NDPS also. There are 3 schedules, 1, 2, and 3. 3 schedules of NDPS. These are some of the derivatives of the barbiturates. These are also covered under the psychotropic substances and NDPS schedules. And there is another, along with the barbiturate, this methaclone. Methaclone is also, this is under the name Mandrex also. There are two components in the Mandrex. Mandrex tablets are there, but this contain methaclone, which is a controlled substance. And this has a hypnotic and sedative and a high physiological and psychological dependence is there. Means it is addiction liability is more, and its effect is 4 to 8 hours. This is methaclone. Then after, these are the some of the tests for the barbiturates. This is a color test, then TLC, then instrumentation like IR, mass, and quantitation by GC and HPLC and LCMS. These are the common techniques. SOPs are available in the United Nations manual or the forensic lab manuals also, working procedure manuals are there. Detailed SOPs can be referred from there. Some are there in the website also. And Directorate of Forensic Science Services is having also their manuals on the website for various type of like narcotics also manual is there. So what protocol they follow, the detail of the common tests. It is not necessary that all the tests should be performed for all the narcotics which we are receiving or whatever here. These are all, so we are getting difficulty. We use two, three techniques also. Material quantity of the narcotics sometimes increases also because they use diluents. They have a very high potency. Heroin as such cannot be taken. A lot of diluents, heroin, morphine, in that it is added. So these are the some of the tentative tests. However, the only because in forensic there is a problem compared to pharmaceutical, that pharmaceutical there is a specific protocol. But here there is no specific, only guidelines are there. Ultimately, we have to find it out that which substance is there and how much quantity is there because of the matrix problem. There are a lot of adulterants are there in forensic. So that is, we cannot restrict the methodology. Sometimes we have to use some methods which are not there in the working procedure manual also. And we can use the research papers also for finding the correct analyze what is the substance. So this is the HPLC analysis of barbiturates. Then methaclone examination, some of the tests are there. Cobalt thiocyanate test, and then Pfizer Morris test, and TLC, and general protocol for all. So I will go fast now because already I am exceeding the time. Some another 10-15 minutes I will take if the time permits. Then some of the minor terpenoids are there. These are the trade names, and this is benzodiazepines. Benzodiazepines, all forms are there. Chlorozepam, nitrazepam, diazepam, very commonly used in for medicinal purposes, and these are covered under the NDPS Act, and they are coming under the psychotropic substances, and they are covered under class 2. All are given in the narcotics, and narcotics psychotropic substances are given in the class 2 only. Section 2 only, but different under the different clauses. So psychotropic substances means any substance, natural or synthetic, or any natural material or any salt or preparation of the such substance or material included in the list of psychotropic substances is specified in the schedule, and also those are covered under the schedule of NDPS. Means there are schedules, some of the overlappings of the schedules, like in NDPS Act also same substance is given schedule, and in the NDPS rules also the schedules 1, 2, and 3. So this whatever if it is given in the schedule, then it is covered under that. Then this is the tentative testing protocol for the this benzodiazepines, and all these techniques are common. Only color test and thin layer chromatography there is a change. Otherwise, all the techniques are more or less same. Mostly for confirmation purpose, IR and mass is used for confirmation purpose. And I think without that, nowadays, the report of the forensic lab is incomplete, because that confirmatory and foolproof identification is done by using these 2-3 tests, mostly SPLC, mostly infrared and spectroscopically, and the mass spectrometry. So this is diazepam mass spectrum. Then there is amphetamines. Already this is a CNS stimulant, and this is also covered under the NDPS section 2 class 30 and under psychotropic substances. This is the definition, and under rule NDPS rules, these substances. And chemical tests, these are the general chemical tests. These are Simon test is specific, and ninahydrine reagent also used, and the Marcus reagent is also a common test for many of the NDPS. This is a total ion chromatogram of amphetamines, and this is the mass spectrum of the amphetamines. Then comes the category, seventh category. We have mentioned 9 categories. One is the Lsd and other hallucinogens. This is this structure is like this, and this is also under section 2 class 23rd psychotropic substances. It's also covered under the psychotropic list of the psychotropic substances under the schedules, and under the first and third schedule. Mostly these are all psychotropics are concerned. This is hallucinogen, these hallucinogenic properties, and then this is the test are given here. These especially this Alrich reagent is specific for this, and these are some of the instrumental methods, and TLC solvent system and display reagents. These are the blue or purple color spots are coming. Use Alrich reagents itself is used for spraying the TLC plate, and these are the LSD mass spectrum. Then comes the control drug or analog. This is also very important because a lot of designer drugs are being synthesized. Fentanyl and this MDMA, methylene dioxyamphetamine, and methylene dioxymethamphetamines. They are the designer drugs only, and further a lot of other molecules are being synthesized by the drug peddlers and the illicit laboratories. So this controlled substance has a higher than average potential for abuse or addiction, and they range from illegal to street drug to prescription medicines also. It is amphetamines are used for medical prescription also, but they are psychotropic substances and the same class 2 of the 23 class of the section 2 and in the NDPA schedule. And this is these are some of the chemical tests and the TLC and chromatography and instrumental techniques which are used for identifying methylamphetamines and amphetamines and designer drugs also. Then there are organic solvents, inhalants. Organic solvents are highly volatile compounds and act on CNS depressant and exist either in gaseous state or at room temperature and rapidly evaporate from liquid state when exposed to air. Some of the commonly abused solvents are paint thinners, color removers, ghee, gasoline, and other petroleum products and cleaning fluids. Now, one more thing is there, one more category is there in the NDPS. These are all the 9 major categories. Those are called precursors. Precursors means the chemicals used for the manufacture of the illicit narcotic drugs and psychotropic substances. As such, there is no law for these type of chemicals, but in the other way, they are under control because if the person is not having these chemicals means stock of that should be maintained under the other acts. Otherwise, it will be considered that as if it is more quantity might be using for the purpose of production of NDPS. They have a lot of other uses also for the consumer goods and pharmaceuticals. So, but there is no, as such, there is a, in these sections in NDPS, give any impression that unauthorized possession of precursor chemical is an offense. No offense, but the law only requires persons such as manufacturer, importers, or exporter consumers and declare to maintain recorded and file reports to journal directors of the NCB. This only mentioned. So as such, there is no law under the NDPS for these precursors. So if there is a shortage of precursor chemical, there is no adverse presumption against there will be that the person regarding it has been diverted for illegal manufacture. If there is a shortage of these precursors, so that should be used in the manufacture, and that they should justify that how much quantity is used for that purpose. So so there is a legal presumption must be introduced that any person is found with this unexplained stock of a controlled substance, precursor chemicals, it shall be presumed to be meant for sale or illicit drug manufacture. Conversely, this stock are found to be short, it should be presumed that short precursors have been diverted for illicit manufacture. So these are the precursors of the NDPS, and these are some of the other legal implications like commercial quantity and small quantity. So these precursor chemical are used for society, but the early disposal avoids deterioration and minimizes wastage. So courts cannot grant bail to those accused of offences 1924-27A for offences involving commercial quantities. So term commercial quantity applies only to drugs and not precursors. That precursors are also exempted from them because there is no, as such, there is no law for them that they are not covered under NDPS. So what are the how this manufacture of narcotic drugs is completely prohibited. These drugs are manufactured completely, like crude cocaine, ecogrenine, and distal morphine, heroin, and their salts. They are completely prohibited. Even the research scholar should not do this mistake to attempt to synthesize for the research purpose without the permission of the narcotic commissioner, because their manufacture is completely prohibited. This category. And the drug manufactured only by the government, opium and alkaloid bars, these are the government drugs, or if the government permits, then only they can be synthesized by the private or any other form. Otherwise, it will be manufactured in the government opium and alkaloid bar, which are available, which are there in Neemuch in Madhya Pradesh and Ghazipur in Uttar Pradesh. Then morphine, codeine, all these Thebane, these are all drugs which can be only manufactured by the government factories, or if the government thinks, and then they will give that it is necessary to give license for it, and they will give. Which can be manufactured after obtaining a license. These are the psychotropic substances whose manufacture is completely prohibited, and psychotropic substances whose manufacture is permitted, but only for they were the narcotics drugs. These are the psychotropic substances. So this is given in the schedule, list of psychotropic substances in the schedule of the NDPS. There is a one schedule in the NDPS section. These are completely psychotropic substances whose manufacture is permitted. So Schedule 3, some substances are there which can be license can be given and can be manufactured. Then another is psychotropic substances which can be manufactured for sale in India or on export. So these are this is also under the schedule, and in Schedule 3 of the NDPS rules, some of the chemicals or drugs are given which can be manufactured for export purpose only. They have no, they are not having any use in medical use in our country. So this Schedule 3 and Schedule 1 should be seen before doing any work on this. So these are some of the then some illicit laboratory I want to tell about that. This is concerned with the more of a forensic purpose or the law investigation or they so these sometime in crime scene the police take to the forensic experts. So there are some of the clues in for the illicit manufacture, that some they are having running water and some of the chemicals which we can smell also, which are being in an abundant area, and some of the these utensils are there that we can guess that might be using as a illicit manufacture. So illicit laboratories like opium and morphine has a smell of acetone, ammonia, acetic anhydride. Even in distal morphine also there is a process of acetylation. So that needs acetic acid and acetic anhydride. So these smells will definitely give some gas. And then there is a cannabis concentrate, that ethyl alcohol, organic solvent, petroleum byproducts, all these if available, then there is a chance that there is a cannabis resin is there, that there may be illicit preparation of the cannabis. And so then these are some of the clues for illicit laboratories. Then there is a sampling procedure for sample for the forensic lab and for the police. They take up to 10 samples. All the samples are sent. If 100 packages are there, then they select about 10 packages and they randomly select and send it to the laboratory. Otherwise, it will be difficult for laboratory to analyze all the packets. So there is a sampling procedure given, standard sampling procedure. According to that only they have to sample. If it is more than 100, randomly select the package equal to the square root of the total number of packages. So this is the guidelines for the packaging for the investigating agencies or investigating officers. So these are sampling procedure. Then for LSD, they are in the paper tablets or gelatin form and generally not encountered. The single package, this sheet of paper should be subdivided and considered as one container. And average, because there is a there are so many small that in the paper, so many small tablets are there. So that there is a provision for how to consider single package or not. Then multiple procedure as above is carried out in doses, units, and similar to that done in the multiple package of the other drugs. So this is the procedure. This is from the United Nations manual, how the sampling is done for NDPS substances. Then smaller and this quantity also very important, because a smaller quantity there is a less punishment, and for commercial quantity very stringent punishment. This has been from 2008 onwards. Otherwise, earlier percentage was given that we have to find it out percentage, and when if now that they consider the total quantity whatever seized, including the diluent and the any adulterants, that will be included in that. So the work of the forensic scientist is now easy, that they have need not to do the quantitation in each and every case, because it is very difficult. In many of the cases, we have so many difficulties. So in quantification, because we don't have standard reference standards are not available for narcotics, and a lot of other problems like matrix problems. So exact quantification, lot of instability of the active principle in the narcotics. So now this law has been amended. Now quantity, only quantitative, but as such seized quantity by the police, they consider as for the purpose of small and the commercial quantity. So this is a format for CFSL for reporting. All details are given. These are some of the details, and then because in forensic there is a chain of custody. One of the things that how it has come, from where it has come, from where it has gone, who has handled it. All these details are there in the report itself. Then the test are also mentioned, and the report is given. Generally, we don't give. If it is negative, we never give like that. No NDPS substance detected, because there is a that very difficult in a screening. Very difficult to exclude all kind of NDPS which have a separate separate procedure for separation, for identification. This is general procedure we have given. Under this general procedure, so many substance cannot be screened. So that's why we give generally report will be, or whatever test we have done for whatever categories we have done. Even for categories also, so many chemicals are there, designer drugs are also there. Difficult to give. Some people give like this only. Narcotic and psychotropic substances could not be detected. The common narcotics and psychotropic categories like stimulant, like like hallucinogens and others. They give or mention the categories and then they give the report. So the forensic report is also very, with the very intelligence is to be written, and this is the format. And this legal standing of a forensic scientist, they are covered under 293 Criminal Procedure Act, and report is signed by the chemical examiner, because by virtue of their designation in the government, they are entitled. But lower officers are also entitled under different Evidence Act under Section 45. But this level officers all are eligible, so that their report is directly admitted in the court. And even if the court doesn't ask for the court testimony or for the delivering the evidence in the court and verifying that he is an expert of this field. So these who are covered under 293 CRPC, but those who are not covered under it, they have to go to the court of law. They have to prove that they are an expert of this field. So this is some of the court. There is no time, but these are the general question asked in the court of law, and some cross examination also done in the court of law for a forensic expert. So or for any other departments also having, like narcotics departments having their own lab, the revenue department also having their own lab. They are also doing a testing of NDPS substance. So this is these are some of the difficulties for NDPS, that analytical technique used for identification NDPS should be very accurate, sensitive, requires easy sample preparation, less time consuming, should be at least prone to contamination and decomposition. And these are the care should be taken. Know the structure and composition of the seized unknown NDPS. Because to give somebody unknown, and you know that a lot of chemicals are there, organic, inorganic. So which way he has to go? And people expect from a forensic scientist that he will do everything. But unless and until some clue is given, so better it is up to the investigating officer to give some clues. If it is there, then it is easy to identify, because there is some unknowns are coming. There is no standard things are coming. In order to establish the identity of any controlled drugs, it is necessary that the criteria is at least two independent analytical parameters. That is two uncorrelated TLC system would also, as a two parameters, can be considered if those who are not having advanced equipment. Then uncorrelated TLC system means either two solvent system or coating on the plate also may be considered. So the selection of two parameters in any particular case would take into account the drug involved and the laboratory resources to the analyst also. So when possible, three entirely different techniques should be used. Actual choice of parameter depend on the description of the chemist. This UN manuals is guiding like this, and we are also following this. So determination of purity of NDPS only possible for those NDPS which are in the pure single chemicals. A lot of matrix problem and others very, very difficult, and which are unstable active principle, difficult to find out the purity. And there should be reference standard, which is the greatest problem in all the law enforcement laboratories. That the standards are not available. They are not being available in the international. Internationally, also only one or two sources. So this is all about. I have exceeded time. Sorry for that. And this is all. Thank you.
Thank you, sir, for
Thank you, sir.
readily
Now I
accept-
request delegate to post their questions in chat box. Now I request delegates to post their questions in chat box.
Thank you, Sarin sir, for readily accepting our request and sparing your valuable time with us to share your knowledge. I request Dr. G. Ramna sir, our HOD, Department of Pharmaceutics and Biotechnology, to interact with sir and speak a few words. Over to Ramna sir.
So thank you very much, sir. So for readily accepting our invitation, for giving a talk on narcotic drugs and psychotropic substances and overuse, sir. So it is definitely very useful to our pharmacy fraternity. So once again, very thankful for your accepting our invitation, sir.
Thank you.
Thank you so much, sir.
I also give thank you to you for inviting me in your faculty development program. Generally, we are doing faculty development for our forensic experts or our professors, assistant professors. We are conducting these programs also. So sometime we may need your help also because pharmaceuticals is one of the important part in our toxicology and in chemistry also, because narcotic drugs are one of the things which are very much coming in the market, and which are a lot of illegal things are being done with the help of them.
So in our curriculum also, we are studying this narcotic drugs, sir, in pharmacology.
Nice.
On that, man. It is on 31st.
Thank you.
Dr. Sarin, sir.
Yes, sir.
One question, sir,
Please.
from delegates.
Yes, please.
Narcotic drugs, what are general toxic effects on health?
There, you see, in our toxicology, we have a toxicology section in forensic science lab. So we define poison. Poison, you will be surprised to know that such a broad definition of the poison, that anything which is harmful, deleterious for the body is a poison. So even some of the drugs like insulin, poison covered under the poison, if it is given to it depends upon the quantity and the intention. Then it becomes a poisonous. If it is given to a non-diabetic person, it may be used as a poison. Or sometime, so this is if the overdosing is there, or some of the drugs are having only addiction liability, and they affect definitely the health also, because then there may be side effects also in the medicinal dose also. But if it is overdose, then definitely this is going to harmful to you. And some of the drugs like heroin, they don't have any medicinal thing. They have only that, problems of psychological problems and dependence. The biggest thing is you become dependent, and you cannot survive also without that. And it is very difficult for de-addiction centers are there, and the narcotics are given for de-addiction in a small dose with a different molecule, which are having lesser addiction liability. So this is the harmful effect definitely is there in the body.
Okay, thank you, sir. Thank you so much, sir, for your enlightened talk on narcotic drugs and psychotropic substances. Sir has explained in detail about natural and as well as synthetic narcotics. Natural substance like opium alkaloids and its identification, different identification tests, and as well as the quantitative methods. Next, in synthetic, mainly the papaverine alkaloid, and semi-synthetics, mainly the different semi-synthetic alkaloids, that is mainly one of the best cannabis products is different identification test and as well as quantitative test. Next, barbiturates and sedative hypnotics, that is methaquinoline, its identification and quantitative methods in detail about the sedatives and hypnotics, and control drug analogs, that is mainly the designer drugs. SAR has explained in detail. SAR has explained organic solvents, that is mainly inhalants and precursors, then as well as illicit, that is mainly the laboratories and sampling procedures of NDDS, and what are the difficulties which is faced in the quantification of NDPS of the substances. In all the narcotic and psychotropic substances, mainly the legal definitions, sections, clauses, and different schedules of the narcotic and as well as psychotropic substances. And SAR has explained legal standing of forensic toxicology reports, different reports. Thank you so much, sir.
So much, sir. The wonderful session we had today on narcotic drugs and psychotropic substances and overview. Dear participants, tomorrow we'll be having the session by Dr. Adinarai Reddy sir from Dr. Reddy's Laboratories, Hyderabad at 10:30 a.m. followed by valedictory session, which will be starting around 11:30 onwards. Sir will be delivering a talk on pharmaceutical product development, meeting global regulatory requirements. Thank you, and well. Tomorrow we'll meet for the session at 10:30 a.m. We are concluding the session. Thank you all.
Thank you so much, sir.
I'm closing the session, sir.
Okay, please.
Thank you.
ఎప్పుడైనా సార్ అర్థం ఉందా